Good afternoon. Welcome to the Multi-Ministerial Task Force Press Conference. On our panel today, we have the Multi-Ministerial Chairs, Minister Gan Kim Yong and Minister Lawrence Wong. We also have with us Minister Vivian Balakrishnan, Second Minister Tan See Leng, and Director for Medical Services, Professor Kenneth Mak. May I now invite the ministers to begin with a few words. Minister, please.
Thank you. Welcome to this press conference. In the past week, the total number of new cases have remained below 100 a day, with the majority from the migrant workers residing in the dormitories. Dr. Tan See Leng is with us today, and he will share more on this aspect. Community cases averaged about 2 a day. We keep a very close eye, particularly on the number of community unlinked symptomatic cases, as these provide an early indication of emerging community transmission. This has remained low at a total of 5 cases in the last 2 weeks. Just to make it clear that it's not 5 cases a day, but 5 cases for the whole of the 2 weeks. These cases were identified primarily through testing of individuals who presented with acute respiratory infection symptoms, or ARI symptoms. Our low number of community cases did not come by chance. It is through the collective efforts of everyone. This has enabled us to allow more activities to resume safely. We also need to continue to enhance our capability to contact trace close contacts to prevent further spread should a case emerge. TraceTogether and Safe Entry play an important part in our efforts to do contact tracing. Dr. Vivian Balakrishnan is also with us today, and he will share more on this part. But even as more activities resume, we will need to continue to protect the most vulnerable in our population, such as our seniors. So for the seniors, group activities are an integral part of the senior-centric programs as they help address our seniors' psychosocial needs and contribute to their overall well-being. We will therefore allow small groups of up to 5 persons to resume activities for senior-centric programs organized by the People's Association, Health Promotion Board, Sport Singapore, and the Council for Third Age. Such activities will also be allowed to resume in our elder care facilities, such as our nursing homes, senior care centers, active aging hubs, senior activity centers, as long as safe distancing measures are in place. We will be working with the respective agencies to put these measures in place. We will also allow our agencies, such as our Silver Generation Office, to begin outreach to our seniors, to engage them and to ensure that their needs are met. The situation in Singapore is stable for the time being, but let us continue to keep up our vigilance and not let the virus have a chance to spread. Each precaution we take, however small it may seem, is the key to keeping our families, friends, and our fellow Singaporeans safe. Let me now say a few words in Mandarin. 社区病例维持在低水平不是偶然的事，而是我们集体努力所取得的成果，让我们能够允许更多的活动在安全的情况下逐渐的恢复。但是就算有越来越多的活动复办，我们还是需要继续保护我们当中的年长的一群。随着社区病例的渐渐稳定，我们会很谨慎的允许更多年长者的活动复办，同时要继续的保护他们。许多以乐龄为主的项目都有一些群体的活动，这些活动可以满足年长者的心理和社交的需求，帮助他们活得更健康。因此我们接着下来会允许一些特定的机构组织恢复举办不超过5人的小组活动。这些机构包括人民协会、保健促进局、新加坡体育理事会以及活跃乐龄理事会。我们的乐龄护理设施也可以采取适当的安全措施来恢复举办这一类的活动。有些年长者也非常想念和他们有关系的这个关怀乐龄大使以及其他的义工，也希望能够和他们有面对面的接触。 他们很多都成了非常知己的好朋友，所以很期待能够跟他们再见面。所以我们从今天开始会重新展开积极的联系工作，关爱乐龄大使、乐龄活动中心、社区资源促进交流与援助小组 （CREST） 以及糖尿病的宣导活动人员，在遵守安全距离的措施下，可以开始主动的接触我们当中的年长者。虽然我们解除了一些措施，我们还是要提醒年长者和他们的家人朋友，继续尽我们的能力来保护年长者的安全。请大家继续遵守所有的安全距离措施，维持好良好的个人生活习惯、卫生习惯。只有当大家能够齐心协力，我们才能够保障社会里最弱势的群体能够得到保护，免受病毒的危害。那么接着下来，我请我们的医药总监Professor Kenneth Mark to give us a brief update on today's medical situation. Prof. Mark.
Thank you very much, Minister. As of today, the 9th of September, as of 12 p.m., the Ministry of Health has preliminarily confirmed an additional 75 cases of COVID-19 infections in Singapore. And based on our investigation so far, there is one case in the community, and this is a person who is a work pass holder. There are 14 imported cases, all of whom had been placed on the stay-home notice when they arrived in Singapore and were picked up subsequently during testing before they were due to come out from their stay-home isolation. Among the 60 cases residing in the dormitories today, 31 of them come from the Westlight To 1 dormitory, the vast majority of whom had been placed on quarantine earlier and in fact were now being tested towards the end of their quarantine to determine their status. The remaining cases were detected through surveillance testing, such as our bi-weekly rostered routine testing regimes. This has allowed us to pick up cases in the dormitory early, including asymptomatic cases, so that we're able to ring-fence them quickly to prevent further infection. We're still working through the remaining details, and further updates will be provided in the evening press release coming out from the Ministry of Health. Thank you.
Thank you. I'll now invite Dr. Tan See Leng to give a quick update on the dormitory situation.
Thank you, Minister Gan. Good evening, everyone. Since the dormitories have been declared cleared of COVID-19 on the 11th of August, there are about 45 new cases of COVID infections that have been detected amongst the cleared dormitories daily. Now, many of the dormitory residents are COVID naive. They've never been infected, so they continue to remain susceptible to COVID-19. However, we are prepared for this. We have put in place a multi-layered strategy to detect as well as to contain any new infections very quickly and very decisively. And obviously, the key thing is prevention. So we put in place safe living, safe working, safe rest days. These are measures that limit the intermixing of workers at the dormitories as well as work sites. And we also ensure that workers who are unwell, they are isolated quickly and treated. And this helps to prevent the spread and formation of large clusters. On top of that, we have also enacted various detection strategies, a number of them to get workers first to self-monitor their own health. And we closely monitor those who report sick with acute respiratory illnesses. And we also conduct wastewater testing at selected dormitories as a means of early sentinel surveillance. And of course, the key sort of hallmark of our strategy is this rostered routine testing, the RRT, which we do every 14 days for every dormitory resident and workers in all of the higher risk factors, the CMP, the construction, the marine, and process. RRT is a key lever in our detection strategy as it is a comprehensive testing for every single dormitory worker every 14 days. And it's very definitive in identifying workers who are infected. Once these are identified, and if they are found to be positive through our RRT itself, we quickly contain and isolate them. So we ring-fence them, we contain the spread by testing and isolating the close contacts, and we also carry out very aggressive testing operations within the dormitory based on the assessment of the potential risk of spread. And these measures have enabled us to quickly isolate new cases at the dormitories as well as contain the spread of the virus. Now, just a bit on the numbers. In early August, we were able to get about 15% of the dormitory residents commencing RRT. As the numbers of workers are undergoing this RRT rose, we saw an increase in new cases detected around the 3rd week of August. As of today, majority of the workers, about 90%, have been scheduled for RRT, and we expect to hit 100% over the next few weeks. This is crucial and this is critical because it helps us to break the chain of transmission. It reduces the number of infections subsequently, and we will continue our efforts to detect new cases early and to isolate them. Now, to date, we have successfully contained more than 200 re-emergent dormitory sites. For the majority of these sites, the number of re-emergent infections has been low. They are less than 10 each. And the re-emergent infection rate amongst those who have not been previously infected is low, at about 2%. I wanted to give you a case study in terms of a dorm where swift containment, isolation help us to curb the transmission, and we work very closely with the dorm operator. I am not going to mention the name of these dorms because I don't want them to relax and rest on their laurels after we mention them, thinking that the fight is over. The fight is never over. We continue to be vigilant. So at this particular dorm, the moment we detected a re-emergent infection at one of the blocks, we quarantined his close contacts. We conducted aggressive testing operations to arrest the spread of the virus. There was no transmission beyond the initial case, and we closed the re-emergent dormitory site. So to further strengthen our efforts in the prevention of new cases, we have also jointly worked with the Ministry of Health under the good office of Min Gan and the team, Professor Kenneth Mark, the new IPC framework. IPC stands for Infection Prevention and Control, IPC, right? So we have a lot of acronyms, so we need to remember them. This was developed to enhance our dormitory operators' knowledge and also to standardize measures across all the dormitories. And it is, in addition to a checklist that's used for self-assessment, dorm operators will be guided also by external independent assessors. They do an audit periodically, and it's a very frequent audit. And they are then evaluated, and IPC experts will conduct their independent professional review. So, moving forward, we will also work with MOH closely to curate health education, public health education and training curriculum, including basic infection prevention and control for migrant workers. And we will partner stakeholders such as Health Promotion Board, the NGOs, as well as consider the use of technology to reach out, to educate, and to train workers. As I've alluded to using technology, we are now going to go further upstream to predict and also prevent new cases, such as piloting wearable contact tracing technology at selected dormitories. That's why Minister Vivian is here as well to support us. We hope to adopt these tokens fairly quickly in the form of first a pilot. This will greatly increase the speed and precision of contact tracing. It will also allow for more targeted containment and quarantine. And quite a number of suitable dormitories have already been identified, and we are now working on operationalizing it sometime in early October. Now, I want to emphasize that we need the cooperation of all stakeholders. We need the dorm operators, we need the employers, and we need the migrant workers to work together with us, to what they say in Chinese, to 配合我们, right? So that we can provide a safe working and living environment for workers to minimize the risks of COVID-19 outbreaks, right? This is a collective effort. I urge all of you to work with us, right? Just one example of a great partnership with another dorm operator. Again, I will not mention name in case after that, the moment I mention, things get more relaxed. I think there are some slides that I can show you to show you how some of these safe living measures have resulted in improved safe distancing and also to ensure that there's no intermixing, and we've been able to bring down transmissions to a very, very minimal number in this dorm. All right? So you can see that fences were erected to completely separate the blocks at the dorms to prevent mixing. If you look at communal facilities such as cooking areas, canteen, they were also fenced up so that they could be split and allocated to different sections. And we actually even allocate dedicated time slots as well as separate routes of entry and exit for and after work. And we have round-the-clock security officers to enforce strictly safe living measures and fire safety. On top of that, we also got safe distancing officers to chaperone workers to work, as well as when they come back. All of this help, and they help and they go a long way. In any sort of re-emergent case, it would be easier to more sharply differentiate between the affected and the unaffected areas. So, thank you very much for your attention. I hope that this message gets out to everyone. Thank you.
Thanks. Now, may I invite Dr. Vivian Balakrishnan to share with us the status of TraceTogether and Safe Entry, as well as the TT token.
Thank you. At this phase of our operation, the key is testing and contact tracing, and in particular, the speed of contact tracing. In the last few months, because of the increasing use of digital tools and data from Safe Entry and TraceTogether, we've been able to reduce the time needed to identify and isolate close contacts of positive cases from about 3 to 4 days in the past. Now, for most cases, it's less than a day. So the point is that speed matters. We have basically two data sets. We're all familiar with Safe Entry, which basically keeps track of people who have attended or visited specific venues. And then we have proximity data, which is on the basis of Bluetooth data, which is generated from TraceTogether. The new updates is that first, we now have the TraceTogether tokens. That is for people who don't want to use a smartphone and download an app. They just want something which is fail-safe, just carry it with them at all times. We've started distributing it to seniors at the end of June. 10,000 were distributed. From next week onwards, the 14th of September, we will start distributing it to the public, starting first in the Jalan Besar area, and we will progressively roll this out on a nationwide basis. So that's the first thing, the availability of TraceTogether tokens for those who wish to use it. For everyone else, I would say the majority, I would still encourage you to continue to use the TraceTogether app on your smartphone if you have it available, because the next step is that we want to augment the Safe Entry program by making proximity data also available to it. And let me explain what I mean. We are now in a phase where we're beginning to open up, for instance, for conferences and other business-related events. And for these sort of events where you're going to have more people interacting, it's not enough to just know who has been in this building, say, in the last hour. You actually want to know, of that group of people who happen to be in the building, who actually has been in close proximity to each other. In order to have that level of granularity, you do need proximity data. So what we will do is that in October, we will conduct a trial where you will do Safe Entry on the basis of a TraceTogether program, either using your app or using the token. And we will roll this out in a way that is seamless and convenient so that actually you might find that it's less onerous and it's transparent to you. Now, I need to emphasize that putting together these two functionalities, which is venue and proximity, will still protect the privacy of the person, but it will enhance the level of protection for the people concerned. The other update is that from the 10th of September, which actually means tomorrow, we will start a new service called a self-check service and an SMS notification. That is for people who have used Safe Entry, and if we subsequently discover that a person who is tested positive for COVID-19 has been in the same Safe Entry venue as you, if we believe that you're a close contact, we will contact you anyway. But if not, and you're just concerned and you can't remember, you can subscribe for a service which will notify you that you happen to be in the same place at the same time, though not necessarily in close proximity. So this will be a self-serve mechanism. But again, I want to emphasize that if indeed you are at any risk, don't worry, we will come and notify you, and we will advise you on the appropriate precautions to take. So that's basically where we're at. I would say right now, as far as the TraceTogether program is concerned, it's been downloaded about 2.4 million times. But we actually still want to push participation in this program, because this is one of those things where the more people we have on board, the more effective the level of protection afforded to all of us. So that's it for now, and I'll be happy to take questions.
Good evening. Let me just say a few words to wrap up this session. We are continuing on our path towards resumption of more activities. And to do that, we need to stay vigilant, and we need to continue with effective measures. And work is continuing on multiple fronts in this regard. You heard just now how we are doing more to actively manage the cases in the dormitories to prevent large clusters from recurring again. We are also doing more to scale up our Safe Entry and TraceTogether programs. So these different measures gives us confidence. With these measures in place, we can progressively open up further and resume more activities. And you heard just now from Minister Gan that we are resuming activities for seniors. That's one area that we have been looking at. Beyond that, for workplaces, we are now looking at how more employees can return to work safely. And the issue is not just about the numbers of people going back to work, as what they had used to do before COVID-19, but it's also about more flexible workplace hours, because we really need to have a good part of workers traveling in the off-peak hours after 9:30. By doing so, we can reduce the risk of large crowds gathering in public transport, in public spaces, and also in office buildings. So the Ministry of Manpower and its tripartite partners are actively looking at this issue. Finally, we are also looking at activities like dining out in F&B outlets. Now, dining out is an activity that all of us enjoy doing. It's very popular, but we also know that it's an activity that carries some risk. In fact, quite a bit of risk, because we are gathered together, large groups of people in an enclosed space without our mask on, and we have prolonged exposure to one another. And that's why we have put in place a whole series of safe management measures in F&B outlets to ensure the safety of everyone. I'm glad that most people, F&B operators and diners, most people are complying with these measures. But there are still a few breaches that we pick up literally on a daily basis. And they typically happen at the popular night spots. Not always, but very often at some of these popular areas. What sorts of breaches? Well, you would see people drinking after 10:30, finding all sorts of ways to disguise their alcohol, but we catch them anyway. You see people not wearing masks. You see gatherings of more than 5, or perhaps people across multiple tables intermingling with one another. And very often, this happens in a private room, because they think that no one is watching, and therefore we book a private room, multiple tables, and we can have our own private gathering. Like I said, we do not think this is happening everywhere, but there are these few breaches that we have been picking up. And the operators who are doing this are causing unnecessary risk to their diners. And I think it's also not fair for the majority of operators who are complying with the rules. And yet these few are taking their chances and breaching the rules. So our enforcement agencies will be stepping up spot checks as well as enforcement actions. Up to now, the approach by enforcement agencies have been to issue a warning for a first offender. But I think enough time has transpired for the entire F&B industry as well as for diners to understand what the rules are and to comply with them. So from henceforth, the enforcement agencies will be stepping up their checks, and once they see an offense, be it by an individual or by an F&B operator, they will take action, even if it is a first offender. And the actions, the enforcement actions, could be in the form of a fine, or it could even take the form of the closure of the premise if the breach is severe enough. For example, if the enforcement officers go in and detect multiple breaches within one venue at any particular time, then they may very well require that place to be closed. Right? So these are actions that we will be taking in order to ensure the safety of everyone when they are out dining. Overall, we are still in phase 2. We are continuing to, progress with or continuing to look at ways to resume activities, more activities safely. I would say our ability to continue on this path of progressive resumption of activities rests largely on two factors. One, we have to control the infection and keep numbers down. Right? So we all have to work hard at that. But secondly, it also depends on our ability to comply with existing measures. Because if we are not even able to keep to the existing measures, then why even talk about further liberalizations or easing, which will cause more problems down the road? So we really seek everyone's cooperation. We understand that there is some fatigue with these measures, but it is very important that we all continue to keep our guards up, comply with the existing measures, and we need everyone to cooperate in that regard. And if we are able to do well with existing measures, keep the infection numbers low, then we can start thinking about the next steps of easing existing measures, move towards a new phase of easing, as well as more opening up of activities. So let's all do our part during this period. We are doing well so far, but we should continue to work hard, stay vigilant, and work together. Thank you.
Thank you. I would like to invite the media to have questions.
Can we have the first question from Timothy from Straits Times?
Hi, thank you, Ministers, DMS. Could you please explain why infections and clusters are continuing to surface in dorms that have already been cleared? I know that you earlier spoke about some of the workers being COVID naive, but since the movement between dorms and work sites is tightly controlled, is there a possible gap somewhere? And is intermingling within dorms a possible reason for continued infections? Thank you.
Thank you. I think that it's important that we all realize that the majority of the population are COVID naive. That means they've not been exposed, and therefore because of that they are susceptible. Now, from the literature, I think you would have also had access to quite a number of these reports internationally. Up to 30% of the infection itself, the infected individuals are asymptomatic. So that is the reason why, and because of the way it spreads, many of them, there are two categories. There's the pre-symptomatic ones where, of course, they then go on to develop the acute respiratory illness with the full symptoms. But there's a huge group of them who are asymptomatic, and after a while they just recover. And that's how we are finding out from some of the serology that we picked up, that they are COVID negative, but the serology shows that they've had an infection sometime in the past. So we believe that there are sort of simmering infections like this that's still happening, and that's why we migrated to doing the RRT, because that's the only way in which, when we subject the entire population to repeatedly testing every 14 days, we will cover one round of all of the, I mean, if you work out the math itself, on average on any given day we test 7% of the migrant dorm population. So in 14 days we test 98%, right, which is, so they go through one cycle. So every 2 weeks they go through one cycle. Now, does it mean we miss on the 2%? No, it's not that we miss on the 2%, because don't forget, the moment in the RRT we pick up a re-emergent sort of number, we actually lock down the block and we test everyone. So because of that, we cover. So we believe that this repeated testing, rostered, routine, and that becomes part of our routine itself, will continue to allow us to weed out this thing and bring it under control.
Thank you, Minister. Can we have the next question from Zhao Bao? Yun Zhou?
Hi, Ministers. Just like to find out for the testing at the trial testing for TraceTogether on these designated places. What kind of venues are we looking at apart from the MICE venues that were mentioned? Thank you.
Thank you. We intend to just start this pilot in MICE and other kind of venues where you're going to get larger groups of people, where there may be interactions without all full precautions, as for instance, at MICE events, there may be meals and so on. So we want to start to check how effective this program of combining data from TraceTogether and Safe Entry is, before we make decisions on how we progress in the future. I think the key theme to remember, both in terms of the earlier question about dorms, and also what we're planning to do now, in how can we return not to the old normal, but to a new normal where we can have activities, but to do it safely. It requires intensive and recurrent testing in the case of the dorms. And in the case of the community, it requires intensive and meticulous contact tracing ability. If we can get these two variables maximized, it will be possible for us to resume a more normal life and still do it safely. So the next few weeks, next few months will be a period of very careful calibration. And the point is, we're trying to use these digital tools so that we can do this without inconvenience, without being intrusive, and to make it seamless and to allow our activities to resume. This is also important, and I should say something also about seniors, because this is actually the big announcement from today is really about seniors. We know that, in fact, seniors are potentially the most vulnerable subset of our population. And in the case of seniors, we have to have systems which are fail-safe, which are convenient, so that the moment we detect any reason for concern in venues and activities, particularly when it involves the seniors, we're able to move in quickly and deal with the problem, nip it in the bud, so to speak. So that's why I keep referring to the fact that the next few weeks, next couple of months, are really critical in our ability to resume some form of normal life safely.
Thank you, Minister. Can we have the next question from CNA Digital? Hui Min?
Yeah, okay, thanks for taking my question. So It's also about dorms. So, it's the formation of the new classes among the dorm residents who are now going out to work. Before they became a cluster, there were workers going out to work already. So does that create a situation where there could be a risk of greater community spread? And is consideration being given to, reinstating the gazetting of the dormitories? Thanks.
Thank you, Hui Min. We have very, very stringent measures in terms of social distancing measures, both in the dorms. We have also very tightly regulated transportation, the logistics of transporting our migrant workers to the work site. And within the work site, they've very, very clear separation zones and social distancing measures. Now, while we cannot completely eliminate the transmission risks, but these risks have been mitigated significantly downwards. If you now go to the work sites itself, the workers are clearly cohorted, separated, and segregated. They have very clear marks on whether it's a safety helmet or even in terms of their safety gear, so that they only work in that section that they are supposed to work in. So there's very clear segregation, right? And then at the dorms, like I said, we continue to ensure that they go for the RRT. And now that more than 90% have signed up, in terms of that regime of that RRT itself, we think that should be able to catch, and as we continue to tighten the dragnet in terms of the people tested. On top of that, we are also now going into, together with TraceTogether, using the tongles and the tokens, to see how we can actually even do preemptive, predictive sort of study to focus on the hot dorms where we are going to have a heightened level of vigilance and surveillance on them. So the dragnet is continually being tightened.
To extend on the Minister's comments as well, we're also using technology to help us to mitigate the risks associated with our migrant workers returning back into the workplace, into the community. So an example which is access code, by which we would also help the employers as well as the migrant workers themselves understand what their risk is as they carry out their normal activities and their work activities. If they miss their routine rostered testing, or if the test results show either a positive result or an equivocal result, these access code indicators will turn red and prevent them from leaving the dormitories and going into the workplace. And this is another measure, an example of how we're using technology to safeguard those in the workplace and in the community.
Hui Min, it would be a great favor that you're doing for us if you could exhort everyone out there, the employers, the dorm operators, as well as maybe less so the migrant workers. I'm not sure whether they read CNA, but at least we can get the dorm operators and the employers to impress on them that this is really a collective effort by all of us. And today there are about 10,000 workers who have not registered on the SRS for the RRT. Of course, we have actually turned the access code red. They cannot go out to work. So that's how we actually contain and quarantine, in inverted commas, this group. We need the cooperation of everyone. So if you could get the message out there, get them to cooperate with us, sign these workers up for the RRT, all right? Then we can have a even more comprehensive and far-reaching solution to prevention, detection, isolation, and containment. Thank you.
I should take this opportunity to add that there is indeed risk in the community. You can imagine that now, previously, these workers were in the dorm, and we cleared the dorm. Now that we have cleared the dorm, they are back to work, and therefore they are working in the work site. And the nature of the work site is there's interaction, not only among the migrant workers, but also with the fellow Singaporeans. They are working at the work site as well. So there will be risk of transmission, and we have also seen a number of Singaporean citizens and PRs who were infected at the work site related to the CMP sector. So there is risk. What is crucial really is to ensure that in addition to what of the measures that we have imposed, the dormitory and the work sites, we need to continue to be quite tight in the social safe distancing measures in the community, so that even if there's an infection in the community, we can reduce the risk of spread and reduce the risk of a large community cluster from forming. And in fact, over the last couple of weeks, we have seen a number of clusters totally unrelated to migrant workers and CMP work sites. For example, your home team cluster, your household cluster, a large household cluster that we announced recently. And these are not related to construction sector or CMP sector, but they were transmission in the community. And as a result of that, we have a cluster. And therefore, if we are able to continue to remain tight in our safe distancing measures in the community, while we cannot totally eliminate the risk of transmission, we can significantly reduce the risk of big clusters from forming. Even the home team, for example, we were able to move in very quickly, quarantine all of them, and test all of them to minimize the number of further infection. Even for the household, although the household itself is quite a large cluster, we have managed to prevent infection beyond the household cluster. So this is why it is important for us to keep a very tight safe distancing measure on the ground. At the same time, strengthen our contact tracing and testing capability. And all these will work together to minimize the risk of community transmission.
Thank you, Ministers and DMS. Can we have the next question from Reuters? Ariana?
Hi, thank you. Just back to the dorms. I just wanted to understand, when we first cleared the dorms, did some of the cases slip through because the PCR tests are not 100% accurate? So there have been like a few more cases. That's when we first cleared the dorms. And if I may just ask another second question, was on the TraceTogether dongle, a token, that is still not mandatory. Am I right?
Thank you, Ariana. Now, I think you have to understand that a PCR test is a test at that particular point in time. So it's a snapshot of the status of the migrant worker at that particular point in time, right? And it's also a function of picking up the virus at a certain concentration. So in the prodromal phase of the virus, we may not be able to pick up the PCR may not be positive. It could turn positive a couple of days later, right? That's why during the incubation period itself, the key thing is when do you sort of do the swab, and when does it turn positive? I think those are sort of questions that needs to be sort of deliberated on. So to your point about whether they slip through, I think it's not a matter of the sensitivity of the test. The tests, indeed, the test kits that we use here, I think approved by MOH, they're very sensitive tests. It's just that at that particular point in time in the cycle of the incubation, we may not have picked up the virus because it's still, the manifestation of it, the concentration is still not reached that level yet. Now, to the point about the testing for up to the 11, we have cleared all the dorms and all the migrant workers have gone through the testing. There's also a percentage, as I've said before, that were asymptomatic. We may not have been able to pick all those things up at that point in time. So that's why we tightened the dragnet by implementing as a back-to-back this RRT. And the initial part, when we started the test, the early ones that we tested, that we cleared, they started coming on stream immediately after the August 11th. And now we've gotten more than 90% of them to sign up. So I think moving forward, we think that the dragnet in terms of by using the RRT to test them should yield much better results in the days moving forward.
Your question on the migrant workers' participation in the TraceTogether program, they would have to either use the app on a smartphone if they have, or they would use the token, one or the other. It's up to them depending on what works and what's most convenient for them.
Sorry, Minister. Just wanted to double check on the TraceTogether token that's being distributed across Singapore. Is that going to be mandatory?
For Singaporeans, no, it's not mandatory. And as I said, we are giving everyone, first, we're encouraging everyone to come onto the program. Secondly, we're giving you a choice whether you want to use an app on a smartphone or whether you just want to use a token. So there is choice.
Thank you, Minister. Next question is from Channel 8 News. Bowling.
Hi, Minister. Okay, following up on the DOM question, I would like to ask whether RT is it the most effective method at the moment? Because, I mean, we still see new cases. You mentioned that we can mitigate the risk, but is there any other way which we can actually find the root cause so that there's no new infection happening? And also, may I also ask about the resumption of activities for seniors? May we know what kind of activities does it include? Does it include singing classes, or what are some of the examples? Thank you.
I will deal with the second question. It doesn't include singing classes. Most of these are likely to be outdoor exercises, and as well as classroom lessons that we will allow the seniors to participate in. But singing generally, we are still not allowing because singing is known to be a high-risk activity. So all these guidelines will be discussed with the various agencies. They will be aware of what is allowed and what is not allowed. And we will also require the coaches, the teachers, the leaders to be registered with Sports SG so that we know who is involved and who are not. And we also want to know the participants so that in case we need to do contact tracing, we'll be able to contact trace effectively.
Just to clarify, also to extend the Minister's comments, we were more cautious in the senior setting because the seniors are more vulnerable. And as we were opening up activities in society, in the community, we wanted also to be assured that we were not going to be seeing a resurgence of high numbers of community cases, which would then expose our seniors to an increased risk of getting infected. So the seniors were one bound behind. As we were opening up for group activities, we were still engaged in individual level activities for the seniors. Now we are allowing much more of group activities, particularly in our senior activity centers, the active aging hubs, where now they can come together in limited groups and carry out group exercise classes. We acknowledge that the benefit of these exercise and rehab classes is not just simply to the individual, but now having an ability to interact with other seniors is also a positive thing. But in these settings, they will still have to respect safe distancing measures, infection control measures, and the relevant mask wearing, even as they interact in these closed settings. So we will continue to watch this carefully, and we will, as time progresses, assess whether it's possible for us to progressively lighten up and allow our seniors to do more activities. But singing is not on the cards at this point in time.
Bowling. So, like I said, it is RRT. It's one of the four measures that I've alluded to. The only way in which we can do this thing well, that we can control this outbreak well, is through active prevention. That's the first hallmark in terms of the treatment and the management of this pandemic, is active prevention. And to that end, we will do everything we can in terms of the infection prevention control measures, and we will continue to be vigilant and be very, very stringent in terms of making sure that this prevention measures are taken on board. On top of that, we are now leveraging on technology, on the use of the tracing together, or the token, or both, all right, to make sure that the ability for us to do contact tracing is sacrosanct, is paramount, right? Now, in the event that this prevention alone by itself, it cannot work, then the next step is detection. And that's where the RRT comes in, right? In terms of detection, the RRT is a very effective and efficient measure. So, like I've said, in 14 days, it allows us to test the entire population that is at risk. Now, pari passu with the detection, the moment we detect, we have to act swiftly to isolate and to contain. So it is all the 4 or 5 measures taken together as a block. This is one of the more effective and sort of efficient way of controlling this outbreak.
Thank you, Ministers and DMS. We have time for 3 more questions. Next up, the new paper, Yu Feng.
Hi, good evening, Ministers and DMS. Actually, I had a couple of questions. One's on the senior activities. So, like you mentioned, they are a very high-risk population. So I'm wondering if maybe plans to, for example, open testing to those who are involved in these activities to make sure that there's no transmission in these cases. And on the TraceTogether app, I wanted to find out, because I remember last week in Parliament, I think SMTO did release some numbers about how these programs have helped find contacts and how. Maybe, Minister, could you elaborate on how effective has the program been? And also on distribution, can we talk about how this is going to be happen? So how many people are looking to distribute to Singaporeans in the next few weeks? Thanks.
Yes, so for the question concerning senior activities, we certainly are going to keep a close eye on these activities and the seniors as well. We have in the past done testing of residents in our nursing homes, only to find that, in fact, there was no significant community spread of COVID-19 in that population. But we will continue to keep a close watch on this, particularly given that we're also progressively opening up to visitors coming into our nursing homes or hospitals, and you could have asymptomatic but infected people then presenting a risk and exposing vulnerable seniors then to infection. So because of that, we are carrying out various testing regimes, surveillance, but in different ways. So, for example, in the nursing homes, we also are piloting the use of wastewater testing in some of the homes in order to try and find out any possible signs of cryptic infection within that setting. So far, we have not found any, and we still continue to carry out very limited but important tests in various nursing home settings as well. We will watch the senior activity centers closely to determine whether there's a need also to extend surveillance beyond just close watch of the health of our seniors participating. But it's important that while we engage in these various surveillance activities, we don't subject the same single individual to multiple testing to his or her disadvantage, because he or she could be staying in a home, could be coming out, could be participating in various activities. We also want to make sure that there's some level of rationalizing of the different forms of surveillance that we're doing for all these seniors as well.
I would say that I will not rule out the testing of seniors in general, but we need to be quite targeted in our testing strategy. This is back to my earlier comment that our testing strategy has to be quite targeted, because bearing in mind that there is a significant incubation period, as Dr. Tan has alluded to just now. If you test the person, it's just at that point in time whether it's positive or negative. It could well be infected, but it's not manifested in the detectable virus load yet. And therefore, if we test it generally, it's not going to be very helpful for the seniors. But as a part of our testing strategy, many of the seniors will be part of the testing candidate, whether it's RRT, whether it's some of them may be involved in working and so on, and some of them may be close contacts in the family and as well as in the community, that they will be tested. So they are not excluded per se, so they will be tested as part and parcel of our overall testing strategy. But whether we are going to do it specifically as a target group for seniors, we don't have plans at the moment beyond the nursing home, which we have done one round, and as DMS has mentioned, generally, I think we are quite comfortable with the surveillance that we have done so far for among the seniors in the nursing home. But we'll continue to monitor and watch, and if there are particular pockets of high-risk activities or high-risk community that we may need to pay particular attention to, we may decide to test them. As we mentioned, we are going to do a few special projects to test specific groups of frontline workers as well as community groups where we think it's worthwhile to test them to give us a sense of the situation at the moment. Again, it's a snapshot. Some of them may be symptomatic, some of them may be detectable, some of them may not be, maybe during the incubation period, but it gives us a snapshot of the current status among this community. So that's more for surveillance purposes. And so that we do from time to time with special projects, special targeted group to do that kind of exercises. And that may include some of the seniors as well. But we don't have plans at the moment to specifically target at seniors per se as a group to test them.
Let me answer the question on TraceTogether. I'm glad you mentioned the answer that we gave in Parliament last week. We carefully drafted it, but then I think it wasn't reported. But anyway, what I have wanted to arrange but have not yet done was to get the media to sit with us in Mandai Hill and to observe how we do contact tracing. Let me just try to give you explain how it was done and how it is done today. In the past, if someone was positive, we would have to send a person, manually interview the patient, and sometimes the patient may not even have been well enough or may not remember enough details. But we would need to ask the person, in the last 2 weeks, can you give me a list of people whom you met? And I think the honest answer is that even if I ask each one of you now to give me a list of people you've met in the last 2 weeks, comprehensively, it's not an easy challenge to fulfill. And that's why it used to take us 3-4 days to come up with that list of potential close contacts on whom we would issue quarantine orders. Now let me explain how it's done today. Today, the moment a case is positive, remember in the case of Singapore, if you're positive, you would have been tested in one of the authorized labs of the Ministry of Health. A digital message would come from that lab to the contact tracing center. We would know that Mr. ABC is positive. We would then create an integrated database. We, for instance, would know who are his household members. We will know who are his colleagues. And based on safe entry data, we would have a list of venues and a potential list of people who may have overlapped in space and time with that person. And over and above that, we would also have TraceTogether data if the person was using TraceTogether, which would give another tentative list of potential close contacts. So the way it works today is when the manual contact tracing team sits down, they will already have a piece of paper which is pre-populated with potential close contacts. And then it will still require manual interaction, because then with this list, you sit down with the patient and say, well, look at this list, look at your itinerary of activities and venues that you visited in the last 2 weeks. Who else do you think you may have met or interacted with or had close proximity with and therefore be at risk? Because of this system, where we're able to integrate different databases and pre-populate the list, it has enabled us to start issuing quarantine orders for close contacts, sometimes as soon as within the same day itself. Now, I can't stress enough how important speed is in this process. We're dealing with an infection. By definition, there is always a transmission chain, meaning I must have been infected by somebody else. And if the pandemic is to continue, I must in turn infect somebody else next along the chain. Now, the probability or the number of people who would be infected is directly related to how quickly we can identify and isolate the person. And what makes it more challenging in COVID-19 is the very large number of asymptomatic carriers. And because of that, you have the challenge in the dorms. So coming back to contact tracing, it has allowed us to speed up the process considerably. We believe it's made a significant difference. In terms of numbers, as I said just now, about 2.4 million people have downloaded the app, but not everyone's app is on all the time. And therein lies the nub of the challenge, because the more people are actively on TraceTogether, exponentially the protective effect increases. So even at today, with 2.4 million downloads, that's still, in my opinion, that's still not sufficient, and we want to make it more convenient, more accessible, and hence we're also rolling out the tokens so that for people who don't have smartphones or prefer not to use smartphones, they can have a fail-safe method to protect themselves. So that's where we're at, but remind me, one of these days we need to bring you all there to Mandai Hill and show you how contact tracing is done in real life. Maybe since I'm speaking from a slightly detached perspective, I've been trying to figure out how to explain this in layman's terms so that you understand the dots between what's happening in the dorms, what we're doing with TraceTogether, and this whole question of resuming activities, including for seniors. So I think there are three facts which you need to bear in mind. Number one, an infection always has a transmission chain. Second fact, in COVID-19, you have a significant number of asymptomatic carriers who can be infectious. Third fact, there are high-risk activities and venues. For instance, singing, eating together, especially family reunion dinners, and living in densely populated communal facilities, whether it is a dorm, an aircraft carrier, or a luxury cruise liner. So these are three fundamental facts. If you bear these facts in mind, why are we doing what we're doing now? So for instance, the first one, transmission chain. You understand now why we are pushing contact tracing, TraceTogether, safe entry, tokens so hard, and why we're trying to reduce the time needed to identify contacts, because that helps us to shorten and chop the transmission chain. The second fact, asymptomatic. Now you understand why Sealing is losing even more hair trying to do regular rostered testing. Because the fact is, your PCR test is a point snapshot of whether or not a patient is shedding viral RNA. It does not mean the person has not previously been infected. It does not mean the person cannot subsequently, in the hours or days after the test, turn out to be positive. But because you have a significant population of asymptomatics, you then need to have regular rostered testing of populations at risk. And populations at risk include places like dormitories, migrant worker dormitories. It may include nursing homes, which I think has already been done. It may include staff working in sensitive venues, whether they may be at risk or they may pose a risk to the patients that they are looking after. So then you understand the reason why we need to have this regular, intensive, repeated tests is to deal with the problem of asymptomatic infectors. And the third point about high-risk activities is the reason why we are so kiasu about all these social distancing rules and numbers, whether it's 5 or what is it now, 50 or 250. It sounds obsessive, but there's complete logic behind it because we know that these are high-risk activities and high-risk venues, and the more precautions, which are ultimately social distancing and mask wearing, the more precautions, the more preventive measures you take, the more likely you are to be effective in protecting vulnerable populations and preventing super spreading clusters. So there is logic to all these onerous things which the people on this side of the room have been imposing. I hope I tried to make it simple enough to explain. Thank you. Did I get it right? I think I more or less was there.
Very good.
Thank you, Minister. Can we have the next question from Wan Bao? Ling Zi?
Hi, ministers. There was a family cluster with 5 young people from 2 households who gathered more than once, one of which also had visited Bedok Camp 2 after his onset of symptoms. So may I check, is there any update on the investigation outcome? Thank you.
I don't have specific information concerning the clusters, but we will try to see whether we can provide more information about these clusters. We have been carrying out epidemiological investigations. The cases that we've been able to pick up across the different families within the cluster, we have been reporting through the media releases that we've given you on a regular basis. At this point in time, we've not seen other people beyond this cluster escaping through our ring that we put up for quarantine. And so from that point of view, it's our belief at this time that this particular cluster is managed, but we do need to make sure that we complete that period of quarantine before we can safely and confidently close the cluster. At this time, that's all I have for you.
Thank you, DMS. Now we have the last question from CNA. Cheryl?
Hi, Ministers and DMS. Last week, PM mentioned in Parliament that Singapore is going to go into vaccine production, although I know some stuff are under OSA, but is there anything that you can update us at this point, especially given that some trials overseas have hit a bit of a hiccup in terms of patient safety? Thanks.
Thank you very much for the question, Cheryl. I think you're referring to the trial involving the Oxford vaccine, where they had very recently suspended recruitment of patients into the trial. This is in fact a safety measure. It's not uncommon in many trials where we have monitoring panels put up to monitor the safety and welfare of participants in the trial. And I understand one particular individual has developed some symptoms and he's being treated. And as a precaution, they've suspended the recruitment into that study, if only just to make sure that this does not represent an adverse effect secondary to the vaccination. We don't have any further information. We look forward to more information before we can have a proper assessment into the safety and efficacy of this vaccine. This can occur very easily with any other vaccine, and this is why we've always been sharing that the road towards vaccine development is long and can be difficult. Just because we have several vaccine candidates that have engaged into phase 3 trials does not necessarily imply that we will have a vaccine ready for use in the immediate future. And we continue to watch very closely the conduct of these studies to make sure that the vaccine candidates that are currently promising really can deliver on their potential. This is the same also in Singapore. As you know, there are attempts to produce vaccines in the local context as well. I understand that there is one that involves also our academic institutions like Duke and US, and they are in the midst of studies to determine whether this particular vaccine is also safe and efficacious. We continue to wait the results of these studies, and we look forward to promising vaccine candidates being developed and brought into commercial development and made available to the entire population. Unfortunately, many of these vaccines continue to be produced and studied with confidentiality agreements. So while some of these companies and researchers have been kind enough to share some of the data with us, we are not at liberty to share any of that information just yet. But I assure you, we are keeping a very close watch, as is many other countries. We are keeping an eye on which of these vaccine candidates are the promising ones. And we continue to engage these companies with a view towards bringing the promising vaccines to Singapore. But we want to be sure that the vaccines we bring in will be safe, will be able to deliver on the promise that they have, and they will be effective as well.
Thank you. I think important for us to bear in mind that while we remain hopeful that vaccine will come one day, in the meantime, we have to continue to be vigilant, ensure that our safe distancing measures are in place, continue to be careful, and we will step up our enforcement efforts. And this is a fair warning to our operators to please observe the safe distancing measures, because we do intend to enforce these regulations in time over the next few days and next few weeks. And it's also important to bear in mind that Dr. Tan See Leng has mentioned that we need the cooperation and support of our workers, our employers, and the government will support and will work together to ensure safe workplace as well as safe lodging and safe transport. And we also need to continue to push ahead with our TraceTogether and safe entry applications to allow us to contact trace effectively, test effectively, and control, limit the spread going forward. So I think we need everyone to work together to keep Singapore and Singaporeans safe. So thank you very much for coming to this press conference.
Thank you everyone for joining us today. We have come to the end of the press conference. The time now is 6:54. The embargo is now lifted. MOH will be sending updated copies of the media statements to all media. Please keep a lookout for it. Thank you.